We celebrate Community Health Week on 6th to 12th September each year. This year, 2024, mark 46 years of community health in existence. The Declaration of Alma-Ata was adopted at the International Conference on Primary Health Care, presented on 6th to 12th September 1978. So in Nigeria, the Community Health Week is an important annual event that shine on the spotlight of our heroes and dedicated health workers who play a vital role in our healthcare system. This week is not just the week of celebration, but is the week in which we present, educate, and what emphasize on the pivotal role of these our heroes, headed by the founder of community health, Professor Ransom Olukoye Kuti, of a blessed memory. So, there are many things we need to know about these community health workers. A lot of people we don't know much about community health, even those that are in the profession already. They keep asking themselves some rhetorical question which they don't have anyone to answer them. First, I want to tell you that you have to be proud as a community health worker. It is a great privilege to you to become a community health worker. And we don't only celebrate our heroes, we celebrate ourselves as well. So now let me highlight you the few importance of being a community health workers, because they are numerous. You can't mention them finish. First, you know that as a community health worker, you bridge the healthcare gap, in the sense that you are close to the individuals, those in the community. You bring the gap between the healthcare system and the individual who are in the community, those who does not have that opportunity to healthcare system, those who don't have the access to the healthcare system. So the community health are trained to bring them together to provide a quality health care to those in the or those vulnerable people who cannot afford or who have no access to what secondary and tertiary health care system. Then the second thing I want you to understand is you understand the cultural competence of the community. In the rural area, you'll be attending to people from different background of which you don't even know their culture. But as a community health worker working with the communities, you know the cultural competence of the people you are working with. You know how to handle them, both culturally, both educationally, and in the healthcare line. You know how to handle them. It is another great benefit you learn from the community. Then the other things you need to do as a community health worker is health education. That is a great privilege. You educate people on things that can cost them a lifetime ailment. You educate them on how to take care of their lives. You educate them on how to handle some situation that will not lead them into lifetime regrets. So it is a great privilege as a community health worker. Then another importance of community health worker is you identify early the health outbreak and referrals. The early detection and referral is a very vital importance of a community health workers. You are working with the people in the rural area. Once the outbreak or any diseases that is coming out, it's the community health worker that will identify it at the first place. If it is something that you cannot handle, before you say, okay, this case, let me refer it to the higher system where this thing can be managed. So don't ever look down on yourself as a community health worker. And I will also tell you the benefits of being a community health worker. There is job satisfaction. When you are working with a community, that is when you know the importance or you know the satisfaction of the profession you are. A lot of us we end up like say if I know I wouldn't have doing this course. Maybe it's because you don't have the opportunity to work with the communities yet. Maybe it's because there is no job opportunity in Nigeria now, so we are looking for greener pasture elsewhere, like in the private sectors. In such case that you were not wear a code without respect, that is when you will ask yourself many questions. But in community health there is job satisfaction, there is job satisfaction, there is what career advancement. When you are working as a community health workers, you have all the chance to proceed more or to achieve more education. So you can advance in your career to the higher level. So don't let anyone deceive you that community health is not a good course. Not, it is a very nice course. You can be in the community health and have your degree, your masters, and your PhD, and it is well recognized in. So now the another thing, another in or the benefits of being a community health workers is what community respect. You are working with the community and the community they respect you. That is why community health workers are called doctors or where there is no doctors. So at the community they respect you, they accord you with that respect. They call you doctor because you bring healthcare system to them, you bring immunization to them, community sensitization, community advocacy, community diagnosis, immunization, giving birth, and many other things. So once they see you attending to them with respect, they accord you with the same respect. And a lot of people are happy seeing you around them. Then in community health, you have a personal growth and leadership. Working as a community health worker, even as a chief, in that place, you see yourself as a leader. Community see you as a leader. A little health challenges, they come to you, they seek advice from you because they respect and they know that everything you are going to tell them is going to be, they are going to make use of it. Then another thing you have to know is once you see a life changes, a life transforming, it is a benefit for those that value lives. Once you treat someone and you see the life of the person transform, it is a thing of joy, it's a benefit to you. You feel like yes, the work I have done, it is working. So I, as the community health worker all over the world, don't look down on yourself. Work very hard, educate yourself, acquire more skills and knowledge in this profession. This week, from 6th to 12th of September, we are celebrating the Community Health Week. We are celebrating our heroes who work tirelessly in order to ensure that the healthcare system is being given to the less privileged, to those who have no access to healthcare, to those who have not been given quality healthcare. So you don't just only celebrate for the celebration's sake. Know what you are celebrating. So I am Rooney Medic. In community health, I have a Telegram group where job related to community health workers are being shared. I will drop it at the comment section. You also join the group. Then there is also a WhatsApp group, Global Community Health group. It was handled by my comrade and my elder in the profession, Moses Jonah. Is my respected someone. I also drop the group at the comment section. You watch it, you join the group. Then we, the community health workers, we are trying by all means to organize a national conference where our voice, where our challenges, where our needs will be presented, and many things is because of communication and we don't have more privilege like others, or because the government is not respecting recognizing us like the other health professionals. That is where we can put head together, organize a conference where our voice will be heard by Nigerians. So don't forget to follow me, my page Rooney Medic. I speak more of health challenges and possible prevention of health cases. Follow my page. I am on TikTok, I am on Instagram, I am on YouTube, and also on Facebook as Rooney Medic. Subscribe to my channels as well. Thank you so much for watching. Share to other community health groups so that they will be of benefit to it. Thank you so much.